Hello, this is Dr. Grande. Today's question is, what is the course of major depressive disorder over the lifetime? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. So when we talk about major depressive disorder, we're really talking about an episodic or cyclical mental disorder. It's not merely excessive sadness or some sort of state that's maintained that's relatively stable over time, but rather the illness cycles. And one of the characteristics of major depressive disorder is the major depressive episode. And we can think of MDD, major depressive disorder, as being made up of one or more MDEs, major depressive episodes. Now, I won't go over all of the symptom criteria in this video for major depressive disorder, but just to touch on it briefly. With major depressive disorder, we'd expect to see either depressed mood or a loss of interest or pleasure. At least one of those two symptoms must be present, and we'd also expect to see a number of other symptoms, including potentially a difficulty with sleep, difficulty concentrating, a change in appetite, feelings of worthlessness, feelings of inappropriate guilt, fatigue, suicidal ideation, and suicidal behavior. So if the full criteria for a major depressive episode are met, then an individual would have major depressive disorder. We know that the 12-month prevalence for MDD is 7%, and the onset can be at any age. The course of MDD is highly variable. We see a lot of different types of presentations. Now, in order to understand the course, it's important to understand the idea of remission. Remission is a 2-month period where there are no symptoms of major depressive disorder, or one or two symptoms, but the expression of those symptoms is mild. Some individuals will develop a major depressive episode, and they'll never have a 2-month period where there are no symptoms or few symptoms. We refer to this as chronicity. Major depressive disorder can be chronic. We also see presentations where there are long periods of remission, but then the major depressive episodes come back. We refer to this as recurrence, when an MDE returns. Now, some individuals will develop major depressive disorder by having a major depressive episode, but they'll only have one episode, and there'll never be a recurrence. So that episode will end, and the remission will just stay in place. Most of the time, however, we do see recurrence. If an individual has a single major depressive episode, there's a 60% chance that they'll go on to have a second major depressive episode. If they have 2 major depressive episodes, there's a 70% chance that they'll have 3, and if they have 3, there's a 90% chance that they'll have a 4th. We also have data available on the likelihood of a recurrence after a major depressive episode. So after an MDE ends, there's a 40% chance of a recurrence within 2 years, a 60% chance of a recurrence within 5 years, and an 85% chance of a recurrence within 15 years. The average length of a major depressive episode is about 4 months if that MDE is untreated. Now, when we look at the course overall in terms of major depressive disorder, we see that over time, major depressive disorder doesn't really change that much. The likelihood of suicide attempts does tend to drop in middle life and later life, but the likelihood of a completed suicide does not change as people grow older. We also know that a number of people who are initially diagnosed with MDD will eventually be diagnosed with bipolar disorder. Roughly 20% of individuals with MDD will eventually be diagnosed with bipolar. And the risk of that conversion from MDD to bipolar increases with early onset MDD. Now, when we consider the course of MDD, its episodic nature, it's important to keep in mind that a lot of the remissions are partial remissions and not full remissions. So some symptoms are present between major depressive episodes. And we have evidence that supports the idea that continued treatment will most of the time provide a better result. So a lot of times what happens is when a major depressive episode ends, the individual will stop seeking treatment or will not be fully compliant with treatment because they feel quite a bit better after the major depressive episode is over, but there still are symptoms present. So this gives us an idea that major depressive episode may have this episodic presentation, but the mental disorder is always there. It manifests differently at different times. So to increase the chances of better treatment outcomes, it's important to stay in treatment even between major depressive episodes. I hope you found this description of the course of major depressive disorder to be interesting. Thanks for watching.